A Belgian nun lay dying in a mission hospital bed, bleeding from her eyes, her gums, the needle marks in her arms. The nurses around her had no name for what was killing her. No lab on the continent could tell them either. Within days, more patients came in with the same bleeding, the same fever, the same terror in their eyes. Whatever this was, it moved faster than anyone could write it down. And the strangest part is how long it stayed nameless while it was already spreading. By the end of this, you'll understand how a virus with no name managed to kill dozens of people before the world even agreed on what to call it. You'll see how a mission hospital's own needles may have helped spread it faster than nature ever could. And you'll see why an outbreak with almost the same shape showed up again in the same region, decades later, in a place called Mongbwalu. This isn't a story about a single disaster. It's about a pattern that the record shows repeating, and the reasons nobody fixed it the first time. Most people who've heard of this outbreak know the basic shape of it. A deadly new virus appeared in Zaire in 1976, killed a horrifying number of the people it infected, and got its name from a nearby river, the Ebola. The popular version treats it almost like a horror movie origin story, a jungle virus that jumped to humans and burned through a village before science arrived just in time to name it and stop it. That version isn't wrong exactly, but it leaves out who was actually running the hospital where it started and what they were doing with their equipment. The outbreak is documented as running from August through November of 1976, centered on the Yambuku Mission Hospital, run by Belgian Catholic nuns and priests in what was then Zaire. The first recognized patient's illness began around the 1st of September, though the record shows the earliest known case was admitted to the hospital in late August. From there, the disease moved through the hospital and the surrounding villages with brutal speed. Whole families died within the same week, and the hospital itself, meant to be a place of healing, became something else entirely. Investigators who arrived later found the hospital had been reusing syringes on multiple patients each morning without sterilizing them between uses because supplies were desperately limited. That single detail, confirmed by the international teams who studied the outbreak afterward, turned a disease that spreads mainly through direct contact with bodily fluids into something that moved through the hospital's own patients, like a chain letter. The nuns and staff were not negligent by any deliberate choice. They were working with what they had. But the record shows their good intentions turned the hospital into an amplifier. One nun who fell ill was flown to a hospital in Kinshasa for treatment. A Kinshasa nurse named Mayinga Nseka cared for her there and contracted the disease herself. Nseka is documented to have died in mid to late October 1976, with most accounts giving October the 19th, though some give a different date, and the record does not fully settle it. Her case terrified international health officials because it meant the virus had reached the country's capital, a city of millions, and raised the real fear of a much larger epidemic breaking out far from the isolated village where this had started. International teams, including scientists sent by the World Health Organization and researchers from the United States and Belgium, arrived to investigate. They drew blood, they traced contacts, and they eventually isolated a virus nobody had cataloged before. They chose to name it after the Ebola River, deliberately avoiding naming it after Yambuku itself, because they didn't want to stigmatize the village and its people for the rest of its existence. That choice tells you something about how carefully this outbreak was handled once outsiders got involved. But it also raises a harder question. What happened before those outsiders showed up? Here's where the record gets uncomfortable. Zaire in 1976 was under the government of Mobutu Sese Seko, a regime known for tightly controlling information that made the country look unstable or poorly governed. Some historians who've studied the outbreak's early weeks note that local and national authorities were slow to alert international health bodies, and that the mission itself, isolated and under-resourced, had limited ability to communicate what was happening. Whether this counts as a deliberate cover-up or simply a communications failure in a remote region is something historians still disagree on. What is well documented is that once WHO teams and international researchers were on the ground, containment moved fast. They quarantined affected villages. They identified the syringe reuse as a driver of transmission, and by November, new cases had stopped appearing. The outbreak's total toll is recorded by most sources at around 280 to 300 deaths out of roughly 318 known cases, though exact figures vary slightly between the original WHO reports and later academic reviews. Either way, the fatality rate was staggering, among the highest ever recorded for a human viral disease. So the popular version, a mystery virus that got discovered and stopped, is basically true. What it leaves out is how much of the spread was self-inflicted by a healthcare system with no other option, and how much of the early delay came from a government that didn't want the world looking too closely at a remote province it barely controlled. Ebola wasn't an unstoppable force of nature moving through Yambuku. It was a virus that found the exact conditions: reused needles, poor communication, a government uninterested in transparency that let it do far more damage than it otherwise might have. Why did this story fade from public memory the way it did? Partly because it was, in the end, successfully contained. There was no sequel outbreak for years, no headline-grabbing spread beyond Central Africa, and by the 1980s and 90s, Ebola was mostly a footnote in virology textbooks, a case study rather than a household fear. The 2014 West African epidemic is what really put the disease into global consciousness. Yambuku became the origin footnote to that bigger later story, remembered by researchers, but largely forgotten by everyone else. And forgetting it meant forgetting exactly what made it spread in the first place. That forgetting matters, because the conditions that made Yambuku so deadly, weak health infrastructure, limited medical supplies, slow communication between remote regions and central authorities, never fully went away in parts of the Democratic Republic of the Congo. The country has documented more Ebola outbreaks than any other nation on Earth since 1976, more than a dozen by most counts. Each one gets treated as its own isolated event in the news cycle. But researchers who study the disease's history have long pointed out that these aren't separate stories. They're the same story, told again in a different province. Which brings us to Mongbwalu. In the documented 2026 outbreak in that part of the northeastern Democratic Republic of the Congo, health workers again reported a hemorrhagic fever moving through a community with limited access to sterile medical equipment in an area where security instability made it difficult for international teams to move freely and respond quickly. The specific details of case counts and containment measures for that outbreak are still being documented and refined as reporting continues, and some figures reported early on were later revised, which is itself part of the pattern. But the shape of it, deep in the historical record, will look familiar. That's the real reveal here, and it's not a single hidden fact, it's a repeating structure. In 1976, a remote hospital without reliable supplies, a government slow to communicate outward, and a virus that thrives exactly in that gap. Nearly 50 years later, in a different province, with a different government, some of that same gap still exists. The virus doesn't need a conspiracy to spread. It just needs the world to keep treating each outbreak as a surprise instead of as a symptom of conditions that were never actually fixed after the first time this happened. Why does this keep happening without becoming a bigger permanent story in public memory? Partly because outbreaks in this region rarely reach the scale of 2014's West African epidemic, so international attention moves on quickly once containment is achieved. Partly because, as some public health researchers and journalists covering the DRC have noted, chronic underinvestment in rural health infrastructure isn't a dramatic single event you can put a date on. It's a slow, ongoing failure. And slow, ongoing failures don't hold a news cycle's attention the way a single dramatic outbreak does. So each new outbreak gets covered like it's the first. What the record does not settle is exactly how much of the 1976 delay was deliberate concealment by Zairean authorities versus simple lack of infrastructure and communication in an isolated province. Historians studying Mobutu-era Zaire generally agree the regime preferred controlling its image over transparency, but the specific evidence of what officials knew and when during those first weeks in Yambuku is thinner than we'd like. Similarly, full details of the 2026 Mongbwalu outbreak, exact origin, full case counts, how containment actually unfolded, are still being compiled, and some of it may never be fully documented, given the region's ongoing instability. The nun who died first in that ward in Yambuku never got a definitive name attached to the disease that killed her, not because anyone hid it, but because nobody had one to give her yet. 50 years later, in a different province, a different hospital ran short on the same kinds of supplies, in a place still hard for outside help to reach quickly. That gap between the two events isn't really history. It's a warning that stayed open the whole time. If you want to see where that warning goes next, subscribe, because this channel keeps opening the files nobody else wants to reread.